I've been asked to review one of Dr. House's TV episodes, not named after me, but there was an episode where he talked about a cochlear implant in a child. And I've asked him to review it because it's been 75 years since the House Ear Institute was founded, and about 40 years since we implanted our first series of patients. So the cochlear implant is one of our developments which has really revolutionized treatment of deaf individuals. This particular case is a young man, I assume he's in high school, and he lost his hearing when he was about 4 from meningitis. And unfortunately, about 10% of children who have meningitis will or can lose some, or in some cases, all of their hearing. So this is this young child. So he's gone now since he was 4 years old till maybe 16 years old, with basically no hearing and learning to communicate with sign language. So he now has had an issue where he apparently has got a lot of tinnitus or buzzing in his ears. And so he's brought to the hospital. They're trying to rule out all these different issues and then start talking about a cochlear implant, which he says he doesn't want. His mother is supportive of that, but thinks that maybe it would be a good idea. But let's see what happens. So now, with all of this diagnostics test, they take him to the operating room to do a brain biopsy, looking for cancer, which has nothing to do with his hearing loss, obviously. But now let's see what happens now. So there's no cancer. The biopsy is negative.
He's okay with that.
He has no idea what he's missing.
Now they're concerned about. He's talking to his conscience in this, and he's trying to think, well, maybe it's not good that he should have a cochlear implant. So Dr. House now suggests.
Why are you closing? Let's put in a cochlear implant.
Let's put a cochlear implant in.
Really? Well, someone must have screwed up. I'll go track it down.
But
Oh wait, that's a great idea.
But apparently that wasn't put on the consent, or wasn't really discussed. And also the brain biopsy was going in here, whereas for the cochlear implant we put it in behind the ear. So now they skip forward and he's being activated. In other words, they're going to put the stimulation into the implant to see what his response would be. And this is something we do usually about 4 weeks, 3 or 4 weeks after the surgery, not immediately after the surgery. So that I take exception to, obviously. And then apparently what the surgeon does, and the surgeon would not be the one doing it. We have audiologists who are doctors of audiology and highly trained in the tuning of the implant. I would have no idea of what they're doing, but they're the ones that take over and really are the ones that are really responsible to get these people hearing again. But this is the surgeon, and he apparently just turns this thing up all the way, and we'll see what happens now. And apparently he's typing in some things, and it looks very scientific, and then he pushes the button to turn it on, and all of a sudden this poor kid is just getting inundated with sound that he hasn't heard since he was 4 years old. Well, first of all, we don't just turn the volume up all the way. They start at a very low level, and the person doesn't hear anything, and then they turn it up just a little bit, and then they hear a little bit more. But in his case, he's being overwhelmed. Apparently they haven't told him that they're putting in a cochlear implant, so he's kind of shocked to find out that he's got a cochlear implant. So now they're going to talk about, well, we should take it out, and there's a debate with the mother and Dr. House, no relation. And then they're going to spend some time with this child. Now, the next thing that is actually kind of shocking.
I just left the room for a few minutes. You ripped out his implant.
Yeah, here we
So
go.
much for improving his life. I just left the room.
Apparently this young man is not happy with having a cochlear implant, so he decides that he's just going to take it out. And he apparently reaches in and rips it out. That's really not logical, because it's sutured in, it's covered with skin, the electrodes are going into the inner ear, and it's not something that you would be able to pull out. So again, this would not be very practical and not something that we would expect to see. So I think that is kind of my summary of a little bit of these things. I would like to say that the cochlear implant is fantastic. We have now been able to implant children younger than a year of age, and in doing studies we find that those children will develop basically pretty much normal speech and normal comprehension. If we waited till they're 16 years old, the results are not as good. But and many times we do it and it works very well. It's very rare that someone would reject it completely, but they may not get the kind of benefit we would like. So I hope this is helpful, or at least it's interesting. I do like Dr. Howe's program. I've watched it as a medical mystery, and he always seems to come up with the right answer, but I do take exception to this one.
"75 years ago, Dr. Howard House founded the House Institute Foundation, a nonprofit organization dedicated to ear and neuroscience research, education, and global hearing health, so all may hear. This is not only our 75th anniversary, we are also celebrating the anniversary of the first cochlear implant for long-term use and the first pediatric cochlear implant invented and implanted here at the House Institute. Consider joining us in celebrating these momentous anniversaries by donating to this YouTube fundraiser. Your gift helps to advance hearing science here at House. If you like this video, don't forget to hit the thumbs up button and subscribe. And if you're a professional, we also have lectures and surgical videos for you on our professional education channel. Subscribe there as well. Thank you.